Diabetes free India. How is it possible? This is the final video in our 5-part World Diabetes Day series. So far, we have learned 1. Type 2 diabetes is not caused by a lack of insulin. It is caused by insulin not working properly. 2. In most people with type 2 diabetes, insulin levels are high. 3. Why diabetes cannot be managed or reversed with medicines alone. 4. Why organs continue to get damaged even when treatment is followed precisely. 5. How epigenetic potential can be used to prevent even hereditary diabetes. And how even those who have been taking medicines or insulin for years can gain freedom from it. 6. How lifestyle correction can influence genetic expression itself and help overcome hereditary diabetes. If you haven't watched the earlier episodes, please do. To prevent diabetes and gain freedom from it, we must clearly understand the science of the disease. Knowledge is medicine. Knowledge gives us the strength to overcome illness. Our goal is a diabetes-free India, diabetes-free world. Across the last 4 parts, we saw every wrong beliefs or decisions in health can create a multiplier effect. One root cause leading to many diseases. The numbers showing how much illness, medication, and surgery can be avoided through lifestyle change are astonishing. These figures will help each of us to decide whether to remain as a patient or become a new healthy person through lifestyle correction. Let us see how the counts of surgeries and hospital stays would change if type 2 diabetes were eliminated. These figures makes it clear that diabetes is not just a sugar level, it damages every organ. Cardiovascular surgery. In roughly 40% of heart-related surgeries, diabetes has a direct role. If type 2 diabetes is removed, the need for such surgeries would drop by 30% to 45%. Examples including coronary artery bypass surgery, angioplasty, and pacemaker implants. Next is leg surgeries and amputations. This is shocking. 50% to 70% of non-traumatic amputations due to non-healing wounds or poor blood flow are caused by diabetes. Eliminating type 2 diabetes could reduce these surgeries by up to 70%. Next is kidney disease. 30 to 40% of the reason for kidney transplantation or dialysis are due to diabetic nephropathy. With lifestyle correction that eliminates diabetes, the need for dialysis can be reduced by this much. Next is eye surgeries. About 80 to 90% of severe eye problems such as retinopathy are due to diabetes. With the lifestyle correction that eliminates diabetes, the need for these surgeries also will disappear. Next is joint replacements. Among those with type 2 diabetes, 15 to 25% may require a knee or hip replacement. If diabetes is avoided, these surgeries also will decline. If diabetes is removed, global surgical volume could drop by around 35 to 40%. Understand this, along with gaining freedom from diabetes through lifestyle correction, we also gain freedom from organ damage and the surgeries that follows. Another point is infection caused by diabetes. Diabetes not only increases the number of surgeries, It raises the complications associated with surgery. Wound heals slowly and infection risk rises, not only in wounds and skin, but also all infections, including respiratory infections, urinary infections, and genital infections. Think about the financial burden and challenges this creates for individuals, families, and the health system and the nation. Diabetes is defined by high blood glucose. But what happens first is that insulin does not work properly, and to compensate, the pancreas produces more insulin. Pre-diabetic hyperinsulinemia, the state of high insulin before diabetes, high blood sugar appears, can last 5, 10, or more years. In some people with a stronger pancreatic capacity, only insulin is high while sugar may not rise at all. Signs of hyperinsulinemia include hypertension, high blood fat, cholesterol, and triglycerides, dark patches on the skin, especially on the around the neck and cheek, heart attacks and stroke due to fat deposition in arteries, PCOD in women, benign prostatic hyperplasia, that is prostate enlargement in men, high blood pressure and diabetes in pregnancy, infertility, and cancers. Many of these begin with high insulin levels in the blood. Through lifestyle correction, we can overcome not only diabetes but also the health problems of this pre-diabetic high insulin stage. Earlier, we looked at surgery reductions related to diabetes alone. Now, imagine the added benefits when we also reverse the hyperinsulinemia related conditions through lifestyle correction. Surgeries decrease further, hospital crowding reduces, waiting for operations and financial crisis due to hospital stays decrease significantly. Think about it. A healthy population is any nation's greatest wealth. If we achieve health freedom, consider the leap in progress and economic growth for individuals, families, and the nation at large. In developed countries, up to about 20% of the GDP is spent on healthcare. A large part of that goes to illnesses linked to hyperinsulinemia and diabetes. This is why this knowledge matters so much. The foundation of health is 98% lifestyle, only 2% is medicine and surgery. Yet, developed nations spend up to 20% of the GDP on drugs and treatment. Now, ask yourself, will you correct your lifestyle and gain freedom from disease, or remain as a patient taking medicines and insulin injections? Everyone, especially those on long term medicines, should understand how medicines affect immunity. Except for vaccines and antibiotics, most medicines provide relief by suppressing immunity in one or more ways. That means many drugs adversely affect the immune system. As a result, people who take such medicines for long periods may have higher risk of infection and cancers. Medicines also increase the workload of the liver, kidney, and immune system. The medicines we consume are excreted as waste products through our excreta, urine, stool, and sweat. Eventually, entering rivers, drinking water, plants, and food. In other words, the drug taken by each person become a threat to all living beings and our environment through water. Therefore, it is essential that we identify and correct the lifestyle faults that cause lifestyle disease and gain freedom from medicines to protect our future generations from the dangers of drug pollution. This cannot be done by one person alone. It demands a collective effort by the society. Once lifestyle disease such as obesity, hypertension, high cholesterol, heart attack, stroke, and diabetes were mostly seen after the age of 60 or 70. Today, we see them in young adults and even in children. Why? The illnesses like overweight, high blood pressure, high sugar, high fat, and thyroid disorders in parents are being transmitted to children. Defects in DNA from the father's sperm and mother's egg, along with epigenetic changes, are at the root of many childhood diseases. The copy of parental health problems, obesity, high blood pressure, high sugar, high fat, is reaching children. High blood pressure and diabetes in pregnancy causes epigenetic changes, modifications in the baby's cells. Modern studies shows that the seed of lifestyle diseases are passed from parents to children even before birth. In the early years, children learn and follow the family's parents' lifestyle. Therefore, not only genetics but also the lifestyle also children inherit from parents. This is why the obesity, belly fat, hypertension, high sugar, and heart disease that affected parents in old age are now seen in the children in youth and in grandchildren during adolescence. Before having children, every couple should ask, am I healthy enough to give birth to a healthy baby? Do not limit health metrics to blood glucose, cholesterol, and blood pressure. Those are basics. Today, we can measure health much more deeply. Body composition, blood nutrient levels, hormones, toxins, cellular inflammation level, and even very early cancer changes can be detected much before cancerous growth is detected on scans. Knowledge is the path to health. After understanding your health status through modern diagnostic tests and preparation, only when you are confident of good health, you should plan for parenting the next generation. Understand the scientific truth that proper planning and preparation can prevent pregnancy related diabetes, hypertension, abortions, etc., and birth defects in children to a great extent. Everyone must know that many childhood health problems begins with parental lifestyle related genetic and epigenetic changes. Only then we can create a healthy new generation. Remember, the key to child's future health lies in the genetic material inside the parent's cell. The greatest wealth we give to our children is our DNA and genetics. Wrong lifestyle damages and degrades the genetic material. Only a baby formed from a healthy sperm and a healthy egg can be truly healthy. Each person and couple has the duty to protect their DNA, avoid lifestyle factors which make it damaged and disease prone, and take care. You pass it to the next generation, your child, in pristine condition for the good health of your coming generations. Every couple should remember this. The most encouraging news is that most epigenetic defects caused by wrong lifestyle can be reversed in 3 to 6 months through scientific lifestyle correction. And we can gain freedom from lifestyle diseases such as type 2 diabetes. When aiming for freedom from diabetes through lifestyle correction, First, understand what lifestyle really means. There are four main components. One, food and nutrients. Two, activity, both mental and physical activity. Three, rest, both mental and physical rest. Four, freedom from toxins. The scientific aim should focus on ensuring the right amount of nutrition, right amount of activity and rest, and to eliminate toxins. The key challenge is how to implement lifestyle correction in a practical and effective way. Structurally, the body has two major components, fat mass and lean mass. Lean mass means everything non fat, including muscles, bones, blood, etc. Fat plays a central role in regulating body functions. The brain and nerves are primarily made of fat. The membranes of all cells and the organelles are made of fat. Hormones such as leptin and adiponectin released from the fat cells work alongside with insulin to regulate appetite and metabolism. Newer study shows that in people with obesity, leptin levels are high and leptin resistant accompanies insulin resistance, creating health problems. It's not just the amount of fat, but also the type of fat that matters. Fat comes in four types: omega 3, omega 6, omega 9, and saturated fat. Omega 3 and omega 6 fat regulates the immune system or controls the immune system. Omega 6 drives inflammation and defense, while omega 3 enables anti inflammation and healing. The immune system functions best when the ratio of omega 3 fat to omega 6 fat is 1:1. In today's diet, inflammation promoting omega 6 is excessive and healing omega 3 is very low. In addition, saturated and hydrogenated and trans fats are higher. Low omega 3, along with excess omega 6 and trans fat and hydrogenated fat, damages insulin receptors, causing hyperinsulinemia and disrupts the balance of hormones like leptin and adenopectin. In short, excess body fat stored in the body is the root cause of diabetes and related diseases. When the ratio of body fat to lean mass goes wrong, disease begins. In most people with diabetes, fat mass is very high, while muscles and bone are depleted. Therefore, scientific lifestyle correction focuses on rebalancing body composition, lean mass fat mass ratio through diet and exercise, and restoring the omega 3 fat to omega 6 fat ratio to 1:1, which regulates the body's chemistry and immune system. The body's dharma or duty is to perform physical and mental work. The only body part we can willfully activate are the skeletal muscles, the muscles attached to the bones. All other part of the body, including the muscles like heart muscles, are working voluntarily. The human body has about 650 muscles and 230 bones. When we stimulate muscles, we also stimulate the bones connected to them, increase blood flow, and release myokines from the muscles and osteocalcin and other hormones from bones. These hormones activate insulin receptors and boost mitochondrial energy production. Only when all muscles are adequately stimulated through regular structured exercise can blood reach every cell, delivering nutrients and removing waste. To keep body composition and hormone balance optimal, we must stimulate muscles and bones through physical and mental activity in an optimal pattern along with optimal nutrition. Knowledge about health is the greatest strength of an individual, family, nation, and the humanity at large. When everyone receives accurate health knowledge, it brings great change. A diabetes free India should be the natural continuation of our tradition and ancient wisdom. When we examine the role of lifestyle and medicines in health, it is 98% lifestyle and only 2% is medicine. When each person takes the responsibility for their 98% and changes lifestyle with the scientific support, the burden of lifestyle disease falls. Pain and discomfort reduce. Hospitals become less crowded. Treatment costs comes down. Quality of life improves. Life becomes more enjoyable and happier. When such individual victories accumulate, a society with a low burden of lifestyle diseases becomes a model for the world. In this way, India can be the pathfinder in health. Number one, the first type 2 diabetes free nation, India, Bharat, should become the role model for all nations. We often assume that the doctors and hospitals are responsible for our health. Remember, in your health, the role of hospital, doctor, medicine, and surgery plays only 2%. The rest 98% of your health depends on your lifestyle. How do we measure whether your 98% is right? Where do traditional measurements fall short? Conventional care measures only the level of disease, blood sugar, cholesterol, etc. When medicines reduce these numbers, we think our disease is controlled. But if your numbers are better while you still have the fatigue, pain, and other illness, are you really in control? No. Traditional methods cannot measure the health of your cells. Our aim is to change the cells themselves. So we must measure not only disease but also the return of health. With the new testing methods, we can identify which organ are affected, why disease rose, what lifestyle correction can change, how much progress is occurring, and how far health has returned. We must track reductions in cellular congestion or inflammation. When your fatigue decreases and energy rises, it is evidence that the cell's powerhouse, the mitochondria, are being repaired. We stand at a crossroads. Remain a patient or become a new informed person. The most important investment in your life is to gain knowledge, to free yourself from misconceptions and gain the strength to make safe, wise decisions. Correct scientific knowledge is the key to health. Use it to open the door to health freedom. Another important aspect is when someone is talking about the healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later, I resigned from the government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with clinical support, minimizing medication and surgical interventions for lifestyle diseases. The time has come to rethink how we view diabetes. Taking medicines for life is not the solution. Understanding and correcting lifestyle at its root is the solution. Let us unite doctors, patients, families, and policymakers to build a future where India leads the world, not in diabetes numbers, but in diabetes freedom. Share this message with everyone you know because every informed person becomes a step towards a diabetes free India. The answer does not lie in more tablets or surgeries. They lie in knowledge, discipline, and scientific guidance. To learn more about diabetes, metabolic health, and clinically supported lifestyle correction, visit our official website or explore the other videos on this channel. Together, let us replace fear with knowledge, dependence with empowerment, and illness with well being, which develops a confidence in correcting one's own health destiny. As we close this World Diabetes Day series, remember this truth. Type 2 diabetes is not a life sentence. It's a message from your body asking for balance. By listening to that message and responding with knowledge, discipline, and support, we can change the course of global health. Let India lead this movement of hope. Let each of us be a living example that prevention is possible and reversal is real. Together, let us build a future where our children inherit not a disease, but a science based culture of wellness towards a diabetes free India and a diabetes free world. Thank you. Diabetes free India. How is it possible?